Hi everyone, welcome to the Community Health and Wellness channel and to message number 2. Hopefully you've had an opportunity to review message number 1 and reflect on that. It is related to the desiderata. What we are going to be doing is addressing a very complex biopsychosocial issue related to the similarities between HIV and SARS-CoV-2. We will also be looking at SARS-CoV in general. Now, this relationship is often ignored in public discourse, but it is definitively addressed in science research. This microbe is a bit more complex than public discourse would suggest, and addressing the complexity of this will assist with creating frameworks for approaching prevention and intervention behaviors, as well as the development of cognitive schemas surrounding this complex issue. So this microbe is very complex, and we are going to look at some of that complexity. We're going to try to narrow these messages down to very discrete topics so that they are not overwhelming and that they are very brief, but something that you can readily digest. And so the language will be simple, and we will do it in a very expedient fashion. There are a number of biopsychosocial patterns, and this is just a list of some of these patterns for you to consider and reflect on. And so, one, you have a dynamic of this nomenclature around both HIV and SARS-CoV. And one nomenclature dynamic or naming dynamic is this schema of positivity and negativity. And so if you recall, if you were around when HIV was first discovered, you will recall that the language was around testing positive and testing negative. And so you see that same language or that same nomenclature going on with SARS-CoV. And so the language is around, did the person test positive or did the person test negative? And this is very similar to what took place and what takes place with respect to HIV. Another dynamic is that you don't just have a looking at the signs and symptoms for the diagnosis, you have a testing process for the diagnosis. And many people would go undiagnosed but for this testing. You also have a process of testing for antibodies. There's another issue of chronic symptoms persisting after resolution of what would be considered an acute infection. And so again, if you were around when HIV was first discovered, some of these things will be brought back to memory for you. You also have a quiet systemic proliferation going on. And so you have disease dynamics going on that are sort of under the radar. And so it's not always possible to know if a person is positive or negative because there are a number of what are considered asymptomatic dynamics. And that means that the person is not experiencing anything that they can relate as a problem. That doesn't mean that the signs are not there. It just means that the symptoms are either not there or they are so below the threshold of consciousness that the person may not realize that there's anything going on. You also have an issue based upon the literature of co-infections obscuring the diagnostic issues. Another dynamic is related to nomenclature again, and it's the naming of the people. And so instead of referring to people as patients, you will often hear people being referred to as cases. And so there is a pattern of objectifying individuals based upon this positive or negative status. As with HIV, you also have a dynamic known as contact tracing. And so with both HIV and with SARS-CoV, there has been a pattern and a demand for contact tracing. And so this summarizes some of the biopsychosocial patterns that have been seen with respect to the correlations between these two microbes. And just to recap, related to the history of the discovery of HIV, in 1983, Dr. Luc Montagnier out of the Pasteur Institute in Paris discovered what was known as HIV-1. Actually, this particular microbe has gone through a number of names. However, the final name has been HIV, standing for human immunodeficiency virus. For this discovery and subsequent work, Dr. Montagnier was awarded the Nobel. Now we're going to continue on looking at the biological similarities between HIV and SARS-CoV. One similarity involves the initial signs. Signs vary from symptoms. Signs are things that medical professionals can observe based upon diagnostic processes. It's also something that a person can observe. And so there are certain signs related to HIV and SARS-CoV that are similar. You also have a dynamic of initial flu-like symptoms. And so it's very easy to mistake both HIV and SARS-CoV for flu. You will often even hear people refer to SARS-CoV as a flu illness. This, however, is not the flu. And so some of the discussion referring to SARS-CoV as the flu, some of that discussion comes about through a process of minimizing. And so sometimes when people want to minimize what they believe is going on with SARS-CoV, they will refer to it as a flu. You also have similar molecular processes going on with respect to HIV and SARS-CoV. One dynamic that has been noted with respect to this correlation between these two viruses is that you have acute and chronic inflammatory storms in the body. And you also have acute and chronic systemic complications. And so these complications are not just at the front end, but these complications persist over time along with this chronic inflammatory dynamic. Now, I want to reiterate, we are not covering everything in this particular discussion. This is just a basic overview of some patterns that have been noted in the literature. And so just keep that in mind as we go forward, because there are other things to address. We are just doing some basics in terms of looking at biopsychosocial similarities at this point. And so this is a research paper coming out of the International Journal of Medical Sciences. And this is posted by the National Institutes of Health. And this is in the U.S. National Library of Medicine. And so this research paper addresses similarities and differences between HIV and SARS-CoV. Now, the fact that there is a research paper out there addressing these similarities provides indicia that these similarities and differences have been noted and noteworthy. And as you can see, this publication came out in 2021. If you want to see this particular publication in Spanish, it is also available in Spanish. We are going to initially look at some important information in this particular article. We are going to segue into some information provided by the CDC, and we are also going to take a quick glance at related information coming from WebMD. And so to start off with this particular article, The information provides that at first sight, these viruses do not resemble each other. And so the researchers are indicating that these similarities may go unnoticed because of what appears to be on the surface a lack of similarity. However, the molecular processes related to both of these microbes are common. And a couple of things that are noted involve this pro-inflammatory cytokine synthesis, and also some modifications that take place in terms of the intestines. Another similarity that the researchers have noted is this issue of the animal reservoir. And so you have a situation with both of these microbes of this particular microbe, whether it's HIV or SARS-CoV, jumping species. And so in one instance, you have the assertion that it jumped species from non-human primates to humans, and then from bats to humans. Now, with respect to initial symptoms, and we will address the initial symptoms, you have similarities between HIV and SARS-CoV surrounding this issue of flu-like symptoms and symptoms that resemble mononucleosis. And mononucleosis is related to yet another virus. And while you have these similarities with respect to these initial flu-like symptoms, the outcomes for these viruses vary significantly from basic flu in most instances. And so we are going to look at these flu-like symptoms so that you can see some of these similarities, and then start to think about where things diverge in terms of both HIV and SARS-CoV and influenza. Now, initially, when SARS-CoV was being discussed, there were very few definitive symptoms. And so it appeared to be something that resembled a number of things, a number of upper respiratory dynamics. And so what you have here is a more definitive list. And so there has been more effort made to create differential diagnoses. In other words, to distinguish SARS-CoV from anything else. And so the CDC has provided these shared signs and symptoms. And this ranges from asymptomatic or no symptoms at all to some severe symptoms. And so they've identified that shared symptoms between SARS-CoV and the flu include fever or feeling feverish and having chills, coughing, shortness of breath or difficulty breathing, fatigue or tiredness, sore throat, runny or stuffy nose, muscle pain, body aches, headaches, vomiting and diarrhea, and then the change in smell or taste. Now, this information in table number 1 is coming from the article that we are addressing. And there is a table in the article that distinguishes between HIV and SARS-CoV. And in one section, it identifies the symptoms of HIV as in early infection, you see flu-like and or mononucleosis-like symptoms. And so this was actually one way of distinguishing between HIV and SARS-CoV. However, you now see that there are similarities between SARS-CoV and flu symptoms and HIV and flu symptoms. And you also see that both of these dynamics are related to an appearance of mononucleosis-like symptoms. If you look below, you see a WebMD article that addresses this monovirus with respect to what has been considered long haul SARS-CoV symptoms. Now we're going to look at one of the most important similarities, and it relates to what is known as the cytokine storm. And this is this storm of inflammation throughout the body. Now this is continuing on with the article. And you see here that it indicates in terms of similarities again that you see an increase in pro-inflammatory cytokines. And so these are inflammatory cytokines that are supportive of inflammation. And so you see that both viruses generate an increase in the production of cytokines, and that this is linked to viral load as indicated here in the case of SARS-CoV-2. And so you might be used to hearing the word viral load with respect to HIV, but again, with respect to nomenclature, you see that same language being used for SARS-CoV. And so viral load is very important in terms of the immune response. You also see an indication that the cytokines are related to secondary complications in those who have the infections. And so this is the case with both HIV and SARS-CoV. So you can see that inflammation is a big issue with both of these microbes, and this inflammation serves as a marker, in fact, in terms of understanding what's going on with the body. And so if you recall with HIV infection in the past, you would hear about these prolonged inflammatory dynamics that were going on with individuals. And so in HIV infection, you had cytokine releases that created prolonged inflammation, and then all of these disease states that were related to this prolonged inflammatory state. You also had a situation where there was residual viral replication, and this has gone on with both of these situations. And so you also had with HIV, and in the case of SARS-CoV, this information is emerging as more research is being done. You have these co-infections. And so it means that people have more than one infection. And when they have more than one infection, it becomes very difficult to tease out exactly what microbe is causing which symptoms. But these pro-inflammatory dynamics that are going on with these co-infections create a situation where you have very detrimental outcomes in terms of bodily processes throughout the entire body, so all of the major systems. And so another issue is that these inflammatory cells have the capacity to migrate. And so this is the case with respect to HIV and with respect to SARS-CoV. And so you have this cytokine storm being implicated in this acute respiratory distress syndrome that people have been diagnosed with. And you also have multiple organs undergoing major dysfunction. And this is the case with both HIV and SARS-CoV. Now, because of these issues related to inflammation, what you have seen over time with both HIV and SARS-CoV is a therapeutic intervention that involves blocking this inflammatory process. And so that has been seen as the goal, because in many instances, it's not the microbe itself that's causing the majority of the problems. It's the body's immune response to the microbe. And so you see this heightened level of inflammation throughout the body, and the body's immune system going into overdrive. And so in both instances, you see these therapeutic responses revolving around slowing down the inflammation process or stopping the inflammation process, because the inflammation itself is a problem. And so this wraps up our discussion in message number 2 related to the biopsychosocial similarities between HIV and SARS-CoV. Now, when you have an opportunity, you should do further research on these similarities so that you can educate yourself.